Former Bachelorette Claire Crawley revealed she's having her breast implants removed, citing health concerns. The 40-year-old reality star says her body is fighting them, and she's been suffering from health complications for years, from hives to a high white blood cell count. A mammogram even revealed suspicious areas of fluid behind the implants. Crawley is far from alone, and a new study co-authored by a Rice University professor looks at how breast implants affect immune response. Dr. Omid Veiseh joins me now live. Good morning and welcome to Houston's Morning Show.
Thank you. Yeah, thanks for having us on here.
Tell us more about what led to this study and why you've been looking into this.
Well, our team, as part of a large collaboration which involved MIT, Johns Hopkins, MD Anderson, and Baylor, as well as other universities across the world. And one of the things that came to our attention was that, many patients were struggling with their breast implants and were having adverse reactions. For 6 years, our team actually evaluated the immune response to a number of different implant types, which are commercially available today and on the market. And our results indicate that, the choice of the implant has significant ramifications in the patient experience. And some of the implants actually perform better than others when it comes to biocompatibility.
All right, now when you say that, let's talk more about how it affects the immune system when the ones just go wrong, because we know that breast implants can help a woman's self-esteem a lot of times, but they certainly don't want it to be fighting against their immune system.
Yeah. That's exactly correct. So, any implant that goes into the body, of course, it's a foreign substance, so the body is going to be recognizing it as such. And our results indicate that, the way the surface of the implant is produced actually has significant ramifications in how the immune system perceives it. And so, depending on the type of manufacturer, these implant choices could actually very much exacerbate the response. In fact, there was one implant which in 2019 was recalled by the FDA because it really caused excessive immune responses and inflammation.
Now, when we hear about what Claire was going through, it was, an obvious reaction to something, but I would think that could be confusing about what's happening, or you wouldn't be probably thinking about your breast implants. What are some ideas if a woman has implants right now that she should be on the lookout for that might be a warning sign that her immune response is not real happy at that time?
Yeah, so one thing for everyone to consider is that, breast implants are not intended to be permanent implants. And in fact, they do require constant monitoring. So it's important for patients to regularly touch base with their plastic surgeon or a clinical provider. Look out for symptoms such as tightening around the implant. If there's any potential change in the shape or size, or if there's chronic pain, patients should do this. It's also recommended that anybody with a breast implant gets imaging either through ultrasound or MRI at least every 6 years. So it's very important for patients to monitor and be on the lookout for potential symptoms and regularly talk to their clinician.
And obviously every woman isn't going to suffer from this, so I don't want to scare them, but can you give us an idea of the percentage of women who have had a bad reaction to breast implants and end up perhaps even having to have them removed?
So, based on the statistics that are out there, about 50% of patients will experience some type of discomfort with their implants, and the complications arise the longer the implant has been left in, and about 60% of patients will ultimately need reoperation. I would say it's common for patients to get revision surgeries maybe every 10 to 15 years. Depending on the implant that they've used and how long it's been in.
All right, Dr. Veiseh, important information for women to certainly think about if they haven't gotten those implants, and then to know what to look out for if they do have them. Thank you for your time from Rice University today.
Thank you.